Do you think it gets really tricky because a lot of people use suicide or, oh, I want to kill myself in a really joking manner nowadays, that it's hard to know when it's just the boy who cried wolf versus someone who's actually suicidal?
As a friend or as a colleague, I was still asked, like, can you tell me more? What's going on? Sometimes it could be jokes, but sometimes people may be going through something and it's coming out in jokes.
I think the follow-up question is really good because a lot of people don't like it if they say something in the form of a joke, but then you're like, oh, I need to get you help right now. But easing into that just in case it's kind of like a bait they're throwing out there, hoping that someone bites and talks to them about suicide, I think that's helpful. I think about how many people commit suicide every day and how many times could it have been prevented if people around them just knew. Or knew to look out for things, right? Or if they knew that, oh, maybe this is like a symptom of a psychiatric disorder versus like, oh, I'm actually just not handling my life well. You know what I mean? I think about that a lot. It's something I'm really interested and passionate about.
I appreciate you being so open and transparent about that because since COVID pandemic, we've seen an increase in depression, anxiety, suicide attempts, self-harm, even in the emergency department. A lot of people were noticing they either don't have the appropriate coping tools or even an appropriate support system for that.
To someone who is suicidal, oh, I notice that I have a lot of suicidal thoughts, like what's my next step?
Definitely, I think reach out to a mental health professional if you feel comfortable doing so. I know that there are a lot of cultural stigmas still with like reaching out to family, but in the least, I think it's important to talk with a friend, talk with a colleague or family member. If you are feeling very unsafe with yourself, like you might potentially hurt yourself or you have some sort of plan, I would say go to the emergency department. There's a lot of crisis lines out there now. I know that 988 came out last year. It destigmatizes the use of mental health resources because instead of having police officers show up at your door, you would actually be able to speak with a mental health professional on the phone to sort of triage the situation. So they can either send mental health professionals or police officers or something that's more appropriate.
Gotcha. That actually is very frustrating. Like, why is 911 the one responsible for dealing with suicidal cases? They're not trained in mental health.
They're not.
They're not. So why do you think people don't reach out for help? Like, why is it that people aren't going out of their way to bring themselves to the emergency room or even tell family?
You know, up until I would say 10, 15 years ago, getting therapy would have been seen as like a weakness, right? Especially I think in the Asian and Asian American culture. There's a lot about like saving face, and it's not just in the Asian or Asian American community, but a lot of my patients who maybe identify as like BIPOC may not necessarily feel comfortable sharing it with their parents because they don't think that they'll get appropriate emotional like resources. It would be more like go to your room, like you can work through this. Maybe mental health isn't even seen as a real thing in certain communities, and so you end up getting shunned.
It's tough because people will go years and years and years dealing with mental health issues and symptoms, and it just won't cross their mind to seek a therapist. It's not like, even yes, they fear that they might get shunned, but a lot of people won't even think to do that. Do you find like that's more of a prevalent issue, or is it mainly the stigma?
I think it's a lot of factors. So there's the cultural stigma, and I think internally sometimes maybe you're super functional, you're able to maintain your job and work, and you're still socializing. You're not going to necessarily recognize some of the symptoms that you're going through as depression or anxiety because you're like, oh, you know, I'm doing well at work, like that's validating. I'm definitely not depressed or anxious like other people. But there are different levels to clinical depression, clinical anxiety, even things like OCD or bipolar that does show up in different symptoms.
You make a good point that you can see these symptoms on every part of a spectrum, basically. Would you say that every person deals with mental health issues?
Ooh, that's a loaded statement. When I think of like mental health issues, I think of something that requires treatment and intervention. Right. And I do think that some people maybe do deal with some depressive or anxious symptoms that don't necessarily need treatment.
Gotcha.
And that could be because they have internal coping skills. Maybe something happened that's stressful and they need to go for a walk or do something that helps them cope with the stressors, but then they're able to go back to baseline and they're functional.
Gotcha. So for example, everyone could be on the spectrum of depression or ADHD, but you would only consider it a mental health disorder or a psychiatric illness if it crosses this threshold of impairment of function.
So,
okay, this is tricky.
I wouldn't say everyone has mental health issues.
So how do you feel about, okay, this is kind of a segue into another topic we were talking about. How do you feel about people that come in self-diagnosed with ADHD because they saw it on TikTok?
Oh, the general rule of thumb is if you see something on social media, always take it with a grain of salt. And I think a lot of videos these days, they'll show one symptom of a psychiatric diagnosis and they'll say, you know, if you're waking up feeling tired, you might have ADHD, you might have depression, you might have all these things. And that's very much the tip of the iceberg.
Even when you do check multiple boxes for a disorder, I still think it's really tricky to diagnose yourself with it because you're not really doing a differential diagnosis or ruling out other things. So for example, like someone could have weight gain, they could have lack of sex drive, they could have low energy, low mood, and they'd be like, oh, I'm depressed, right? But they could also have hyperthyroidism, you know what I mean? So I think that's a lot of the value of seeking a mental health professional, right? It's to actually rule out other things. Like, yeah, ADHD, I could check 10 boxes for ADHD, but I also abuse substances, or like I just am extremely sleep deprived. So like you're not ruling out those other things. So it's really hard to do it yourself, right?
You bring up a really, really great point, because in our clinic, for any sort of psychiatric intake, we actually get a full set of blood work. We get an EKG to check your heart. We get, urine drug screens, and we basically rule out any other medical issues that could cause some of the symptoms that you're going through. So in the case of like someone presenting with depression, we check for vitamin D deficiency, we check for any abnormal thyroid levels, we check for appropriate like organ functioning, we make sure you don't have anemia. We check for possible signs of infection, because that can all lead to low energy or some depressive symptoms or even poor focus. That's why it's really important to seek professional care, where you can rule out everything else before you start appropriate treatment.
So is there any validity at all to diagnosing yourself with a mental illness? I feel like it's at least helpful to suspect maybe I have this as a way to incentivize yourself to seek professional help. But I think besides that, it's really hard to...
Let's put it this way. If you see something on social media and you feel like it might be affecting you, or you might have some sort of diagnosis, go get an appropriate evaluation.
Okay.
But don't go to a psychiatrist and say, hey, I have ADHD and depression, I need treatment.
So I imagine you get a lot of those people coming in with self-diagnoses, right?
There's definitely been an increase in people referring to Dr. Google for everything.
Where do you draw the line between a clinical issue and someone's life is just genuinely falling apart and it's due to life circumstances that they're feeling this way?
A lot of the times there are external factors. People do lose people and they are in like grief. People do lose their jobs and their financial burdens. People do make mistakes at work, and maybe that results in a lot of consequences, and then that's why they're depressed. Like, that does happen, where there are a lot of external stressors and they end up coming to a psychiatric clinic to get some help. We sort of go over what our options are with treatment, but we also focus a lot on, at least in therapy, what are things that are in our control going forward versus what are some things that we can process and then move past. It's sort of complicated because there are some things where we can't really change, especially with some of our patients who do have maybe a lot of financial limitations. There are limitations to what we can do to help. Like if they have like financial insecurity, housing insecurity, maybe like relationship issues. Some of them are hard.
So it's rare that you'll have someone where like medication is the singular main helpful solution, or are there cases where, oh, it's purely just a physiological thing that just needs medication treatment or other modality?
That's such a general question.
That's such a very vague question. Okay, so this is very vague.
Because I have patients who just are on antidepressants. I literally put them on antidepressants, they feel so much better, and that's it. And then I have other ones who we try so many different meds and then we still can't find a solution.
Okay, so that brings up a good point. So at what point do I decide I should consider antidepressants?
It's hard with antidepressants because usually you'll have that conversation with a mental health professional who will bring it up. But if you feel like very severely depressed, like you're struggling to have an appropriate appetite, you're not maintaining your physical hygiene, you're sleeping all day or not sleeping enough, usually more of the physical symptoms we notice when patients don't have functionality anymore. Like they can't go to school, they can't maintain their work. That's usually when we see them coming into the clinic and asking for help. Okay. And usually I would recommend medication and therapy. Like my gold standard is always medication and therapy. I do understand that that's really hard nowadays just because the therapy is like a 1,000-person wait list.
Yeah.
But in the meantime, while they're searching for a therapist, I usually will go over antidepressant options with them.
Gotcha. And I know antidepressants, some people are surprised by how long it takes. Like it takes sometimes up to 8 weeks or so to see any effect whatsoever.
4 to 6 weeks is usually what we say.
Oh, really?
Taking it consistently every day for 4 to 6 weeks, usually you'll see some sort of effect, but you might not necessarily see complete resolution of your symptoms or a significant improvement unless you're on the right dose.
Gotcha.
So we typically start on a pretty low dose for 4 to 6 weeks, and then we continue to optimize the medication dose.
Gotcha.